One of the big pieces of medicine, as I mentioned earlier, is nutrition and medicine. And so having a knowledge of what different diets do for the fertility potential or the gametes is so important. And there's been a lot of speculation that the Mediterranean diet is the healthiest diet for fertility. But in fact, it's really based on more of the whole food and non-processed component of that. And so I really like to delve into the information specifically about the diets. And there is a wealth of information that eating as much whole food, as much plant-based as we can will dramatically affect the potential for the sperm and the egg or the gametes. And I really encourage patients to avoid packages. Anything that has more than 2 ingredients on it is probably too processed, and to really eat stuff that doesn't have a label. And if you can focus on that, your diet will be improved and your fertility potential will as well. So I think that's super important, not only because I've done so much research on what's available to patients out there with their specific diets, but it's also huge for the planet and it's sustainable. So that's very important to kind of bring in the big picture. In addition to that, I think it's also really important to not get too far ahead in the technology. I want to know what's available for every single patient, and I want to be able to do the maximal that I can to increase their odds for pregnancy. But unfortunately, sometimes in this field, technologies come along and we get so excited that the actual data on the effectiveness takes a while to catch up. And we end up doing a lot of procedures that may actually not be necessary. And that falls near and dear to my heart when we talk about genetic testing of the embryos. And I feel that there are certain patients that absolutely benefit from pre-implantation genetic testing or PGT, but there are certain patients that are only offered that and don't have a successful outcome, and then are guided towards egg donation or adoption when those patients have an option of not doing all the extra testing and all the extra technologies and still have a very good chance at having their own genetic child. So that's something that I'm super passionate about, is look at the individual to see who may benefit the most from all these fantastic technologies that we have. It's not right for every patient.